Well, good morning again, and I want to talk something to you on this particular case. Is a very unusual thing. The pressure of the tongue on this young lady torqued the teeth, and I can show you where the teeth were at a certain angle, and it pushed them up and angled them more correctly. And what happened, we had separated the palate, and the tissue was soft there, and the tongue was able to push the roots of the teeth forward and put a better torque on them. I'll show you that when we get to it. Now let's get, now you can see a little defect in this area. This is short, it's kind of slight class 3. She's missing some teeth, so we add some teeth to this to help out. Now this is looking at the first, but you can still pick up a that portion of the face is not filled out like it should be right there. And we come in and see she's in a kind of a class 3 bite, not a kind of, it is a class 3. And this is permanent teeth out like here, and I think that's the deciduous tooth, with the permanent teeth back here behind this. So we're going to have to open the mouth a little bit and bring these teeth forward over that, and when we did, it changed the torque in them. It made them stick out like this, and then the pressure of the tongue pushes them back. That's all that I can come up with. Now when you study these models, you can see exactly, this is a person who breathes through the mouth, and the upper teeth are kind of fitting inside the lower teeth like this. That shows you there's something wrong going on in here. And so the tongue is kind of spread out back here and wasn't able to get these teeth over the line in this area. Now if we're looking at it from this angle, you can see the upper arch is actually smaller than the lower arch. It's again the same way in the class 3. Now there are missing teeth in this case right here, so we have to fill in and put false teeth in the area. And this is 1983. Here you can see the upper teeth were hitting back here. The angle of them is not very good there. Now this one, the angle is even, and we took the teeth and pulled them out over here, and now the teeth are just look like they're laying down in there. And then a little bit later, we x-rayed this through again, and the teeth are actually sitting up like that. Now, we came back and separated, and now look how this tooth is sitting in here. And it was sitting about like that. And so the tongue, we got it trained properly, and it's pushing up here, and it just shoved the roots of that tooth back. That's the only time I remember, but I'm sure that many cases of that have had that effect, but it's easy to see it here, really. All right, the young lady is missing the lateral teeth up there. She has the deciduous teeth. The cuspids are coming in now, and they're coming right next to the centrals. And here we're going to have to use this follicular movement of the teeth. We're going to have to try to make this follicle fill this out. And this follicle down here, fill that out, pushed it back away from that area. All right, here the tooth is coming down now. You see this follicle is rounded out and pushed this tooth down. And this one is trying to, but it's being blocked off back here. But we keep going in there, and these have moved over, and the teeth are coming in straight down on the bottom arch. All right, these upper follicles had now this finally it formed around arch and kind of ball, and it's just pushing the tooth right down and putting the cuspids up next to the centrals. And so the laterals are missing up above, and we've got a kind of a class 3 look here with this young lady. And so we moved the front teeth over, and it just pushed us way out like this. And we were going to have to come back and torque it out here. And I looked, and without us putting anything, we had a round wire in there, and it couldn't have possibly done that. So the follicle brought the tooth down an instance. If you go back and study these follicular movements of the teeth, how that rounded out in here. The laterals are missing down over the bottom, and so we opened up space for them, and we're going to open some space for the upper ones. So here we go. We've got a deciduous tooth right in the middle of this thing. And the upper teeth are separated quite a bit. We put a palatal separator in, and if I remember correctly, we bonded something on top of it, and we open this thing up, and we push these teeth way out like that. Now you've got these teeth banded, and they carry the roots out with the tooth, and we carry this one back here. We have the wire going over here that brings it out with it, but doesn't get the torque that this one gets down here. So we widened this out and got the tongue functioning properly, and it weakened this area in here, and so the tongue was able to come in behind that and push those teeth out. So again, we're using, to fill in this part of the face, we're using a Hickam chin cup. And we've shown this, and they pull that under their hair, and this pulls the teeth forward. We run right through here with the elastics, and it puts pressure on the chin. It pulls the chin back. It's putting back on the condyle, so you have to watch out that you don't have any TMJ problem with this. And now this will pull the teeth in a forward direction. We're working on the upper arch to get it out. And here's looking like that. You know, when she closes her lips, you see the rubber bands go right through where the lips close to. And that, if you put the rubber band down and it pulls the lip down, the saliva comes out and it chaps the lips and everything in that area. So this is an excellent chin cup to use, and we pull it down, and that is pulling those teeth forward. So we come in, and after that thing has moved those teeth out, now this is where we move the teeth out. These teeth are laying down. Like as we go up the upper teeth, it'll be at an angle like that, and we want them more in this way, coming down in here. And see these, we push this out to correct the class 3, and you can't torque it. We had a round wire on it, and we could have torqued with a rectangular wire, but we just go in with a round wire, and it will not torque the teeth out. It goes out like that. It puts torque, positive torque on, but it doesn't bring the roots of the teeth out. Now and then on this deal, and now I come back over here and I have a spring in there. I still have that round wire, and look how the teeth look there now. Now those teeth, the root is brought out, and the tongue is the only thing I could figure out. This was soft tissue, and it pushed on this, and it's shoved the roots of the teeth out. You can see how they pushed out in that fashion. Then we go back, and you look where they were here, and then you look cut them like that. And the only thing I could say is the tongue pushed that out and kind of helped fill that out. Still looks like a little defect in there. Now there's the way those teeth were. They were laying, look at this right here. See, it's laying down like that. I'll take that away. Now here we go for the date on it up here. And they pushed it over there properly. Now we come in with a rectangular wire. We open the gap and bond two teeth on this arch. And this is just a plastic tooth, but they're bonded and they've got the torque in and they look like they're coming out of the gum right there. They look so real. But now we'll finish this girl out. We fill that in. And so this is restorative dentistry. Using this, we have to come in here now and put teeth in these gaps where she had no teeth to fill that class 3 out. Now we look at this arch, it looks pretty normal now. It's coming around like that, and these teeth are holding this gap open right there. So we build a retainer with that until she gets a bridge put in, or she put a cantilever bridge off of the teeth up there to hold that out as a child. And here she is. She gets a little older. She's still got a very slight depression out there, but not anything like it was. And I knew I was working on some other kids that ran with this young lady. She's a very attractive lady, and she made her look very good, but you can still see a slight deficiency in this portion of the face right here. But if you took those teeth out and brought it back, it really looked bad. And so here's the smile. But we've got those two false teeth you can see sitting in there. That torques that out, and now on the bottom we move the cuspids up next to the two centrals, and now we'll put it and have fill that out. We made a retainer with something in here so she can wear that until she can get a bridge or an implant or something put in that area. Now, if she had had wisdom teeth or something from the back, it might have been possible we would pull those back teeth up and fill that gap. But here's her facial structure as we finish, and it looks almost perfectly normal now. We went from that and that down to the bottom. We put the place spring in there, brought those upper teeth out. From the lower teeth, we opened the gap, put the cuspids up here and made them look like laterals. And now we'll put a retainer in there with acrylic in there. They can come in and put whatever they want to when she gets a little older. And this is the only case that I know of that the tongue actually did the torquing in here. And I wanted to point that out. So you get somebody that the tongue is not being used properly, and you train them, and when the tongue is in there properly swallowing and pressing, it pushes the roots of those teeth out. Now it's an 88, and here we are. We still a very nice looking young lady, but just still a little deficiency in here. But if you took those teeth back, close that space, it would really look bad. So she grows up with just a slight defect there, but not much. It doesn't keep her from looking good. And so you see these false teeth we put in there. She wears those on a retainer while she's finishing high school and stuff. And when she gets pretty well grown, mature, you don't want to put any permanent bridge work in there till they get pretty well through growing. So here these teeth were, and there we are with a retainer, and that's the lower retainer has acrylic in here, and the upper one has these false teeth on it. You don't have any trouble at all getting the child to wear the retainer when they've got teeth like that. They won't, if they break a tooth off like that, they're going to come in and sit in the office until you get it fixed. And they won't even go out some pretty young lady like that. And her teeth are like this, and we went there from this point over to the left. There's the side, and you can see it on this side. Worked out all right. The other side, same way. We added teeth here where they were missing, but we didn't drag them from the back. If she had been a little older, we'd have found it, and she'd had her 12-year molars, her wisdom teeth coming in, we could have moved that up there. From that to that. Thank you for watching, and I hope you'll sign up to our group and subscribe to it. And I'll say goodbye for today, but we may see you again here pretty soon. So I'm going to close out and hope you learned something from this. I sure learned something myself in this problem.